Hey guys, this is Trevor Wicken from medicscoach.com. You're in the middle of a lower leg dysfunction series that we're doing, and we're going through the activations of specific muscles that are going to help our body get back into alignment, get out of that foot turnout, kind of ankle stress mode, the knee falling into the side mode when we're squatting, when we're standing up, when we're doing all kinds of stuff in daily life, prevent knee pain, ankle pain, and SI pain. Okay, so we've talked about the last couple of videos, we've been going over the lower leg. Working on the anterior tibialis, posterior tibialis, and now we got to talk about the hip, okay? So in a couple videos ago, we talked about this TFL and this biceps femoris muscle. When those get very overworked and tight, what they do is they get so bound up and tight that they actually push your thigh bone over this way. What that does is, number one, it causes a lot of stress on this hip joint. Number two, it causes a lot of stress on the knee joint. Number three, it causes a lot of stress on this ankle joint as well. So once we get these loosened up, and we start to get the lower leg loosened up to come back over, we want to give you something in this glute area up here that's going to actually pull you back into alignment so that everything sits in this nice line. The main muscle that we talk about when we're walking is the glute medius. That's the muscle that's right here on the side, or that top portion of that glute. So where your butt comes over and you get that top curve that all you ladies seek for, that's that glute medius muscle. Okay, so when you see someone that has a real flat behind, that means that glute medius muscle has atrophied, and we got problems. They probably have some kind of low back pain, they probably have knee pain, something like that. So one of the best muscles one of the best exercises to work that glute medius muscle is called the clamshell. Okay, so what we're going to do is we're going to drop down like this. Okay, I'm in my beauty shoot mode, so I'm ready, Sports Illustrated. So this is an old school PT exercise, physical therapy exercise, but it's still super effective. There are ways to progress this that I'll get into in later videos, but I want to keep it real simple for you guys because a lot of you over 50 that are watching this video are not going to be able, you may have some hip pain or knee pain, you're not going to be able to do a straight leg lift, which is really good for the glute med. So we're going to bend that knee and shorten up what's called your lever arm. So in this position, what you want is you want your hips stacked, which means this hip bone should be over this hip bone, okay? Your shoulder blade, your trunk should be straight down the middle. You're going to be supporting your head with your hand. You're going to take your knees and just slightly bend them and then pull those toes up just a little bit. So you're in this position. Then you're going to push your hips forward, okay? Because you don't want to just lift like this because you could be activating and reinforcing that tight TFL muscle, which we don't want. So we want to actually push our hips forward so it kind of externally rotates our leg and gets us into the booty, okay? So what we do is I want you to put your hand on your hip, put that thumb right in that glute medius, push your hips forward, pull your abs in. You're going to keep your feet in contact with each other, and all you're going to do is just rotate up like that. You're going to hold for 2 seconds, bring it back down nice and slow, about there, bring it up, hold for 2 seconds, bring it back down. Now, quick disclaimer, if you've had a hip replacement, make sure that you put a towel or something in the middle of your legs here because you don't want to drop past midline. So if you're pretty close to having a hip replacement, you're 8 to 16 weeks out, you don't want to internally rotate that hip because that's a risk factor. So you want to make sure that you kind of stay a little bit open that way. Okay, so again, coming up, using this glute medius muscle back here. 1, 2, coming back down, pause, coming up, abs in, butt tight. 1, 2, coming back down. So there's step 1, do a shapely booty and less painful knees. So I'm going to stay like this till the next video.